Hi, I'm Christie Slaughter, and I'll be your host today in the Pursuit podcast. We are lucky enough to have Gretchen Fowell, a medical provider in the community, spend time with us answering questions such as, what supplements should you be taking every day? When should you get on antibiotics? What is best for your family needs and healthcare issues? Please stay tuned, watch our episode. It's really exciting, and help me welcome Gretchen Fowell.
69-foot pursuit. Stop! Sure, stop!
Hi, Gretchen.
Hey, Christy.
Thank you so much for coming today.
Thanks for having me.
So we put out a post to our listeners asking what kind of questions they would want to know from their health provider. Maybe they don't have the time. Maybe they have wanted some information. They don't know where to go. Maybe they don't have healthcare insurance. And I thought of you right away because you are just the picture of health in so many ways. Can you introduce yourself, talk a little bit about your background, your medical background, and kind of why you do what you do?
All right. I'm Gretchen Fowell. I'm a family nurse practitioner, meaning I see patients, babies through elderly and everything in between. I started as a registered nurse and graduated from Montana State University. Go Bobcats. In 1998, I worked at Benefice as a labor and delivery nurse for 7 years, and also as a high-risk Mercy Flight nurse for high-risk OB patients for 5 of those years. Yeah, that was pretty cool. And went back to school and got a master's degree in nursing from Gonzaga University in 2006, and have practiced since then as a family nurse practitioner, mostly at the same place at Great Falls OBGYN Associates, where I serve everyone family practice, but a lot of concentration in pediatrics and women's health. And then for 2 years, I worked with Dr. Mike Garver at Premier Care Pediatrics doing just pediatrics. So it's a long time. It's funny, when I had about 10 years experience, I thought, well, that sounds good. Like I'm experienced, I know what I'm doing. And now when you say 17 going on 18 years,
Wow.
I sound old.
Yeah.
But
And so much life wisdom, though.
yes, you really get through the years a lot of experience. What I tell patients now is far different than what I did 18 years ago, and life experience. Before you have kids, you tell people things by the book, and now I'm like, just wing it, and we'll figure it out later.
And I love that about you, because I really think that I could go to you and tell you almost anything that's going on, and you are not a judgmental person. And I think sometimes people are afraid to even tell their doctors the real truth, and I don't know, exactly why.
That's good.
And so when we put out the questions, we had a request for questions. We had a lot of people asking questions. I'm going to start with one that I got quite a bit of questions about and pretty much summarized it. I am always tired. I get enough sleep, but I always wake up groggy and feel that way most of the day. Is this normal, or should I see a doctor?
That's a very common complaint in my patients, and the most common population that I see is women of childbearing age, women who have small children. They're all tired, and so they kind of think maybe this is the way I'm supposed to be forever. So it can be normal, especially people with small children that are busy, working moms. Everybody's tired to an extent. But I think it's important to talk to your healthcare provider if you're more tired than you've ever been, or you're getting enough sleep and you are still very tired, because there are medical conditions that can cause extra fatigue. Mm-hmm. So it's a good idea to just ask and look into it.
Well, and when you're talking about being a mother of a mother, it is so exhausting. I mean, you're up at night, and working moms or stay-at-home moms, either way, it is a very hard job. And you have to, I kind of sometimes think that Mother Nature had it backwards, that kids get more energy as we get less, and how are we supposed to keep up with that?
Yeah.
In your opinion, as far as vitamins go or supplements, is there a vitamin or supplement that we should be taking?
Not necessarily. most of our vitamins come from diet. And if you're eating a good, healthy diet, you really don't necessarily need a bunch of vitamins over and above. I usually recommend a multivitamin. My pregnant patients take a prenatal vitamin. It's a great vitamin. So I tell them, just keep taking it.
How long can you take that?
You can take those always. You don't have to be pregnant. You don't have to be a woman of childbearing age. It's just a good multivitamin. And really any of them are okay. Those supplements are not regulated by the FDA. So we don't really know what's in them. So from brand to brand, it's not regulated. So they're not all created equal. And
Interesting.
we don't know what to tell people as far as the best one. You can spend a lot of money on vitamins and
not really know what you're getting.
Yeah.
So is there a truth in their advertising when they say that a certain vitamin does not interact with your body as well as others, or they don't absorb into your system? Is that true?
That is true. Some people don't absorb vitamins as well as others. We know that because we supplement sometimes, particularly vitamin D in the last 10 years. Mm-hmm. And some people, I can give them high-dose prescription strength vitamin D and it never comes up. So there is issues. Everyone absorbs medications and vitamins differently. So it's not a one-size-fits-all. There's no, this is the perfect dose and we don't always know that. So you have to be careful because some vitamins, most water-soluble vitamins, are excreted through urine. So if you get too much vitamin C, you'll pee it out. So no harm in getting extra. But the fat-soluble vitamins, A, D, E, and K, can be dangerous at high levels. So more is not necessarily better. And so you want to be careful with that. Some people, think vitamins are pretty harmless, and most are, but some are not. So I always tell people, talk to your pharmacist or your healthcare provider about if you need an extra vitamin supplementation and what that might be.
Okay. Now, when you're talking about the vitamins and that you might not need one, is that just for a certain age group, or would you recommend like somebody over 50 or 60 take calcium for bone strength, or would there be a certain age that you would definitely recommend a supplement?
Yeah, the general population, people, non-postmenopausal women generally don't need an extra vitamin, but postmenopausal women, once your estrogen levels decrease in menopause, they are at risk for bone loss and osteoporosis. So we do recommend a calcium supplement twice a day, and any of the over-the-counter calciums are just fine. And so I tell people, however you like to take it, whether you like a pill or a Viactive chew that's chocolate or Tums, chewy Tums, I think they're delicious.
Sure. Okay. And so when you say premenopausal, what age does that start? So
any women of childbearing age up to, and menopause starts differently for every woman. Average age in the U.S. is 52. Once they start hitting perimenopause, where they're getting hot flashes, night sweats, having less periods, that's a good time to start a supplement. The definition of menopause is no periods for a year. So once they hit that point, we're always talking about calcium supplementation.
Okay. Is there any other supplements that once you start menopause that you should take?
Not necessarily, no.
Okay. How long does it last?
Oh gosh,
symptoms?
That is the $1 million question,
Yes.
Chrissy. People will say, how long will I have all these hot flashes? I don't know.
Really?
Everybody's so different. I have some patients that it can last years.
Wow.
And you never want to tell people that because they are in miserable hot flash city. So it's like, I don't know how long it will take. And there's things we can do to help with symptoms. And so we always offer them those, but it's so variable from woman to woman. I never like to tell people what to expect.
So this is kind of an odd question maybe, just because we are talking about the menopause for women. Is there anything that is similar that a male goes through?
No, it's funny you say that. There is some, you'll read about the male menopause.
Yes.
Because men, as they age, get lower testosterone levels. That's just normal, just as women lose the estrogen level as they... So it's normal to have a decreased testosterone level. That's a whole different can of worms. That is another podcast, Chrissy, about whether men need testosterone supplementation, whether we should test it. That's not something that I am an expert on in my clinic, so I end up sending them somewhere else if they're interested in that. But it has been dubbed the male menopause.
Okay.
So, but we
So
don't.
just a lack of testosterone, and we can talk about that another time because it sounds like it's a lot of explanation, but just that women in menopause start to lose estrogen and eventually men start to lose testosterone. And I heard you earlier talking about a healthy diet. How does that play into, I guess, what is inflammation of the body? Because I hear a lot of,
Yes.
do this so you don't have inflammation, but what does that mean? Is that in your joints? Is that in your, like, what does that mean?
That's a good question. It's a buzzword now. If
Okay.
you look on the internet, you will see a lot about inflammation. There's, a lot of inflammatory markers in the body. Inflammation, if you were to get a cut on your arm, you would have an inflammatory response to go heal it. You get your white blood cells go to the area, they fix what's wrong. So we all have a degree of inflammation. In disease states and where your body's trying to constantly repair itself, you have a high amount of inflammation. And so the talk about inflammation is more like, how do you stay away from it? Are there inflammatory foods? Not really, per se. You want to keep a nice, healthy diet to keep your body from having to fight off disease. And so inflammatory markers are not routinely tested for, but if I have someone that comes in that has a bunch of joint pain and things I can't explain, I tend to order those and run those, and they'll be high, and then I go, like, what does that mean? In and of itself, it doesn't mean a lot, but you want to always have a nice, healthy diet. Obviously, 100% of the time is not real accurate, but if you can get to a healthy diet of an 80% of the time you're eating good, whole, healthy foods, you reduce inflammation because you reduce the risk of disease.
So when you said that when you have someone that comes and talks a lot about their joints hurting and you run tests and they come back high for what? For white blood cells?
No,
or high?
inflammatory markers, a CRP level,
Okay.
C-reactive protein is one of the inflammatory markers that we will run from time to time. And it's a non-specific test for inflammation, and we do it for looking for different sort of where to go with a workup. But most people will have normal inflammatory markers. If they're slightly elevated, it doesn't really tell me a whole lot. But usually, like if someone comes in with, let's say, a mono infection, they've got mononucleosis, their inflammatory markers will be huge. And we would expect that because they're fighting off that virus. And so you wouldn't see it if I were to draw your CRP today, it would be normal. If it was high, I'd say, I don't know why that would be high. We'd probably retest it. So it's kind of...
So in hearing you talk about it, it's kind of interesting because when they use the word inflammation, it's almost always in a negative context. But actually, when you're talking about inflammation, it helps your body heal.
Yes, it is a good thing. It's how our body works to heal. So, yeah, you're right. It gets a bad rap. And do we know if people have inflammation? Like you just hear that word a lot, and it's like
A lot.
I don't know. Do you really have a lot of inflammation? Do you have things going on? Do you have heart disease? Do you have high cholesterol? Those things will cause inflammatory markers to go up. And they're looking at that now, all the causality. Is it important to draw CRP levels? Does that tell us your risk for a heart event? It's a piece of the puzzle that's drawn and looked at. But you're right. We all need inflammation to heal.
So am I understanding correctly that inflammation, a heavy level of inflammation or a level that you would be concerned with as a medical provider is usually secondary to an illness, like a major illness.
Yep.
So it's not something that is a daily day activity that people say, oh, I'm just so sore, I must have inflammation. Okay.
Yep, agreed.
So it's usually an indicator that there's a bigger issue in your body.
Yep.
Interesting. Okay. So there are
You
a
nailed
lot
it.
of,
You're an honorary nurse practitioner now, Christie.
Okay.
You start on Monday. You have 10 patients.
10? I don't know about that. What's the favorite part of your job?
The favorite part of my job is getting to take care of families for a lot of years. And watching those kids, I get graduation announcements, and I'm like,
gosh.
oh my God, I'm old. But it's really fun to see I've taken care of patients that are as babies that are now having babies. Bizarre, but very fun. And to get to see see kids grow up and go to college. I have a lot of patients that are in college and then come home and hear about what they're doing. That's my favorite part.
That's awesome.
Yeah.
And I'm sure they thank you in their graduation.
Yes, I get a lot of those, a card and saying, I remember coming in to see you every time I was sick, or I'll be out and about and somebody will come up and give me a hug, a little kid, and that's just fun.
Cool.
That's the fun part.
Yeah. And do you think that you specialize in women issues? Because you see families, so you see men as well, but do you feel that you kind of have a little more insight on women's health?
I do, just working where I work. I work with a great group of OBGYN providers that have taught me a ton of women's health over the years. As a family practice provider, we get to know a little bit about a lot of things. And so you touch base on everything from babies to old people, but we don't specialize in any one area. So I feel lucky because I've gotten to work with specialists in the area of women's health. So if I have a question, I go down the hall and ask our women's health nurse practitioner, hey, Lori, what do you think of this? And I get the benefit of having those experts.
Multiple resources. That's
And
awesome.
so I feel like I have more experience and expertise in women's health than an average family nurse practitioner. So all of where we work and the population we work with kind of determines our specialty area, so to speak.
And this is a really broad question, but how do you think women's medical treatment is different than male medical treatment?
It's funny. So I do see men in my office. They are always appalled to come into the OBGYN associates, but they're very different patients. Most of the time I say, did your wife make you come in? Yes, she did. And most of the time their wife is my patient, and so I know them. Yeah. They rarely come in. They really want to come in, seemingly. Women are better about getting their yearly exams, maybe because we were taught to do that as a young age, or once you're having babies, you're in there regularly, and then they see you yearly, and we're doing things like pap smears that are expected. But my male patients tend to only come in when something's wrong, and usually very late in that process. Or when I did clinicals in the emergency room, the male patients would come in and was like, when did you do this? You cut your arm with a table saw yesterday? Great. Well, now we can't sew it up. Like, they just are different in that way. And I appreciate that about my male patients. And not to say they're all that way, but they're just funny. And they don't want to go in. And why do I have to go in? Nothing's wrong. I don't have to go in. Well, you do. You need routine health care just as women. But they definitely seek care for different reasons, I would say.
Okay. That's interesting. So, and as far as male health care, what ages should they start getting testing? I know at 45, there's different.
Every age group has kind of certain screening things, men and women. I usually suggest, so my patients will come in and I'll say, we should have a lab test done for a baseline, just routine screening labs at around 35.
Okay.
It's just
Male or female?
Male or female. To have cholesterol panel, just general lab work. If they have other high-risk reasons, a family history of high risk of heart disease or something like that, I'd recommend it before then. But most of my healthy patients, I recommend that. Some are lucky enough to get it through their job, through work. So I'll have 20-year-olds bring me their cholesterol panel. I'm like, well, that's good. They're always pretty normal. But in general, that's just kind of a good time to start getting routine screening labs. And if they're normal, I'll tell patients they don't necessarily have to have it every year. They could do every other year. But in women, generally, especially over the age of 50, they have an increased risk of thyroid disease. So we recommend yearly labs.
What are the symptoms of thyroid disorder?
So the hard one is fatigue. And we talked about that, like women being tired all the time. It's like, as a young mom, it's like, is this a thyroid problem or not? And we don't know until we draw lab work. Fatigue, hair loss, dry skin, which living in Montana is a little bit hard to judge, weight gain or weight loss, and sometimes women with hyperthyroid, it's running too high, will have heart racing. But really, the thyroid affects nearly every body system. So It has a ton of different symptoms, constipation, and they're things that people get anyway, so they're hard to differentiate. So we usually draw the lab test to tell us.
What will happen if you don't treat an under or an overactive thyroid?
Well, you'll continue to have those symptoms and just getting worse and worse. So we always treat it. We always supplement a low thyroid with thyroid, artificial thyroid, T4. We give that to them daily and then monitor the levels. And then same, we will treat overactive thyroid as well. So most would be, there'd be no reason not to, just
Right.
a pill every day. And but yeah, people will find it how much better they feel once it's treated and go, oh gosh, I was feeling worse than I thought once you get it normal.
Right. Okay. We talked a little bit about vitamins and kind of some supplements that either, the market or advertising or big pharma is kind of, they try to push supplements and maybe some issues that make people think, is this wrong with me? Like we were talking about the inflammation. Can you talk a little bit about how our diet affects our overall mood, which it seems like when you go to the doctor, there's not a lot of conversation about the type of food you're eating. And on the opposite spectrum, the food industry doesn't really think about how that food impacts our bodies. So what is the balance there?
That's very true. I think most of what ails us, most of our day-to-day complaints could be fixed with proper diet and exercise. It's getting people there that's the hard part. If I get someone at 40 years old that's eaten the same way since they were 10, it's very hard to get people to make changes. Yeah. And I think I'd like to say that I talk a lot about diet because I believe in it, it's important. But over the years, I'm probably less so because I feel like it kind of goes on deaf ears. We all have these patients that you have prediabetes, you have prediabetes, diet, exercise. Oh, now you have diabetes. And then they're kind of like, they're surprised. Why did I get diabetes? We talked about this. So you kind of get disillusioned over the years of the value of talking about diet and exercise. I hope I haven't lost hope altogether. I'd like to talk to people if they're interested. I'm not a dietitian. I can give basic dietary guidelines, but I'm like, hey, why don't you go see the dietitian? Like that's their area of expertise. And some people are very willing to do that. Most are not.
So do you have dietitian on staff?
We don't.
Okay.
We use the outpatient dietitians at Benefice, and then there's the clinic used to have one. I think they still do. So we'll send there, and then there's some private practice ones that we can send. So there's resources there. But trying to get people to use them is different. And it may not always be covered by their insurance. So there's real barriers to that. But I think it's important, and there's so much information out there about foods. You should eat this, you should eat that people get overwhelmed. They don't know what to do.
And what is the right thing to eat. And you're not just educated on these issues, but you live this life. And
yes.
And another thought, I would like to actually have you on again, just to talk about your, I'm going to say, just awesome achievements that you've made. I mean, just for like a little tidbit or aside about, just talk a little bit about those things.
So it is important to me, and I think
your award or your
thank you.
Yes,
I think diet and exercise is important to me, and I think you're right. And provider biases come in to play all the time, right? So if you get somebody that's like, they don't maybe themselves practice those things, it's hard for them to recommend.
Sure.
And so, or sometimes at the other end of the thing, I think the spectrum, I think people look at me and go, well, what do you know about weight struggles? And that's hard for me too.
Sure.
But we all have them, and you have to work at them, and everyone's different that way. But I think as my patients maybe struggle to ask me because of their own insecurities about diet, weight, exercise. At the same time, I get a little funny saying, it's hard for me to say, oh gosh, I get it. I get it that you're 80 pounds overweight or 100, because I really don't. But I can get the 10, 15 pounds or being tired to exercise. I can get that. But for me, I have just as many struggles as everyone else. I work, I have kids, I referee basketball, I have a lot of other commitments, but you have to make the time to do it. And everybody can do it.
Yes.
And so we had people say, well, I can, I'm busy. That one's hard for me because I'm like,
This is your life. Are you too
everybody's busy.
Yes.
Yes. And so I try not to get my bias towards that I like to do it because I know not everybody likes to exercise. So I'm like, well, what do you like to do? You should go, like, whatever your activity is. So people want to know, how often should I exercise? I think that was one of the questions that came into us.
Yes.
And I used to probably give some ridiculous answer from the American Heart Association. You need to do 30 minutes of, cardiovascular. Now I change it. I say, you need to do whatever you can do and whatever you like to do. So I'll start by saying, you need to do 5 minutes a day. People look at you like, oh, right, 5 minutes a day. That's what you need to do. 5 minutes a day for 2 weeks. And that's dumb. And I say, I know you think that's dumb. But everybody could do 5 minutes. You could do that while you're watching TV. You could do it, early in the morning. So do 5 minutes of whatever exercise you like, whether it be jump rope, or you like to do burpees, said no one ever, something like that, 5 minutes.
5 minutes.
And then you add 2 minutes the next week. And then the next week you add 2 more minutes. Because studies will show you it takes 15 times of doing something for it to become a habit. So how do I get someone to do exercise 15 times that hasn't exercised in 20 years? I'm not. They're going to do it once and be sore and cranky and not do it again. So I've tried to do things like that over the years, like just adapt how I tell them and say, like, you don't have to go to the gym because that's daunting for people who've never been to the gym. You don't have to. You just need to move your body.
You don't have to run a marathon. You don't have to do a
No.
spinning class. You could do yoga. You could do Pilates. You could stretch.
Anything. Walking if you...
Walking.
Yeah, try to get your husband involved or your kids. And so I think I've changed how I talk about exercise because the best exercise is the one you do.
Okay.
The one you don't do, that don't work.
That doesn't work.
So so for just getting your body moving, and that for me has probably gotten frustrating over the years too because people just don't do it.
Can you talk to me about when you exercise, what happens in your brain?
So we know that you release endorphins when you exercise, which is a happy hormone, as they say. So we know that the body likes to move and you will respond positively to exercise. Now, my anti-exercisers, that's pretty hard sell because to them, they don't think it's enjoyable. But we know that. They've studied the brain chemicals. So if you can get to the point where you like it, they will receive those benefits of exercise. But that's very hard to get someone to do that, thinks they don't have time or they just don't like it.
Well,
It's
I feel
hard.
like we're in a culture where everybody wants immediate gratification. And the exercise might feel good after it doesn't feel good while you're doing it. But also eating this donut right now would make me feel really
Yes.
good. Or binge watching this TV show would just definitely right now make me feel really good.
Yeah.
And it takes, like what you said, what did you say, 18
15
times? 15 times for it to become
Yes,
a
and
habit.
so if you've got, or people say, I tried that. I've tried diet and
tried
exercise
that. Yeah.
for a week.
How long?
And I didn't lose any weight. And so I quit. And so that's frustrating to me because or I'll say, don't look at it as your weight. Look at it as your health.
Right.
And we're trying to make health changes, which are slow, especially if you have someone who has not exercised in 20 years
Sure.
or is 80 to 100 pounds overweight. It is very daunting. So if we can get them started, and I have a few patients that have been pre-diabetic and now are not.
That's amazing.
And that is huge.
Can you talk to me about what happens? Because I don't think that people realize the time commitment about what happens when you do get diabetes. What does your life look
Yeah,
like? If you were to give me a diagnosis today that I have diabetes, what will I have to do?
You'll have to test your blood sugar for me 4 times a day.
Oh,
Fasting in the morning, 2 hours after each meal. And they don't have to do that forever, but they have to do that to start so I know where they're at. And so that's hard. No one can
Yes.
do anything 4 times a day. Like, so that's crazy. Would have been far easier to do the exercise. But so I meet people where they're at. Like, I don't shame anybody that gets diabetes. We certainly just work through it. But that's huge. So now you have to test your blood sugar 4 times a day. Now you have to take an oral medication twice a day. And it changed your life. A medication you didn't have before. Now you're testing your blood sugar 4 times a day, and you're now constantly having to think about what goes in your body.
Because there's certain foods then you absolutely cannot eat at all, correct?
Well, and I'll tell people, so that gets them a little scary too. So I'll say, you can't, it's not that you can never have a birthday cake. You can, but you have to watch sugars, simple sugars, carbohydrate. It changes the way they eat, or it should. Sometimes it doesn't. But I'll say, it's not to say you can never have a treat. Or maybe you have a low sugar, diabetic recipe cake. But I try to make it seem like, this is doable for life. I tell people the diabetic diet is how we should all eat. It's not anything fancy.
Really?
It's not that you can never have any sugar. It is just low glycemic index foods that don't shoot your blood sugar up real quick.
Which are?
The simple sugars, those are the easy ones people know, cookies, cakes, things like that. But carbohydrate, which we all eat and need to eat, they're not all created equal. So if you and I were to eat, you eat a plain white potato and I eat a sweet potato, my blood sugar will not jump up as high as yours. It's a lower glycemic index food. So fruits are not all created equal. So berries, blackberries, blueberries are lower glycemic index than like oranges and bananas. So I just tell people that's where the dietitian comes in, because they will give you real foods to swap out. And not to say you can never have fruit as a diabetic, but you should choose the other fruits. But that's what we should all be looking at, especially if people, their goal is to have weight loss, or decrease their insulin resistance. They have a long family history of diabetes. They should be looking at the glycemic index on foods instead of, you read all these things and there's all this information out there, but it's really just a good, healthy diet, how we should all eat.
So in conclusion, the diabetes diet is basically trying to restrict those fine sugars, or the sugars, eating certain fruits, kind of like a meat and vegetable diet, closer to like a paleo type diet. Okay.
Yeah. Sometimes people want to know exactly how they should eat. Should I eat the Mediterranean diet? Should I eat the paleo? It doesn't have to be one or the other. There are parts of all of them, but if you look at all of them together, they're all the same in that they don't have sugar.
It's the sugar, isn't it? It is.
Sugar is the devil. No, I don't.
Is there? Why is that? What does sugar do to your body?
I know. Well, so you eat sugar. Okay. Your pancreas produces insulin to counteract it. That's how it works. So all day long, if you sugar, insulin, you can develop insulin resistance because you're constantly producing insulin to counteract it. Whereas if you eat a lower glycemic diet where your pancreas isn't pumping out so much insulin, you don't develop insulin resistance. You have a lower risk for diabetes. So that's why sugar, unfortunately, it tastes good. And there are now a lot of sugar substitutes, and whether you think those are okay or not, there's ways to sweeten foods that are not simple sugars. But if you don't like those, or you get headaches or something from artificial sweeteners, you can have sugar. You just want to choose the better ones and in very small amounts.
Over the last couple years, I've really been looking at the back, and I probably should have been doing this a long time ago, but of boxes of food and see what's in it. And it is crazy. I mean, some of them have 30 things in it. And I've been doing my most to make all of the food at home that I can. But
Wonderful.
It does have quite a bit of sugar in it. I will try to use honey.
Yes. Which is good. And you do want to sweeten things or your kids won't eat them. And maybe your husband.
Well, and I love to have a dinner that everyone sits down and everyone eats a dinner, because that is just so important for our family to have that time.
Yep, you're right. And food is a very important part of our lives. And so it should be good and it should taste good. And I think people that if you work at it and you're looking at whole foods, you can make good food that tastes good and have it be healthy. It doesn't all have to be, rice cakes and green beans. So it just takes work. And that's kind of where we get the disconnect is it's work. And you have to do, you have to prepare food. And that's hard in our society where we're go, go, go. And
go. And we want everything right now. And things are in packages.
Yeah, it's faster.
And I will point out that the healthy food is more expensive.
True, very true, and that is a real problem. I know our the WIC program years ago had pointed this out. Like, we've got to give people good healthy foods for our WIC program and our disadvantaged people. So they did do that, and they did coupons at the farmers market here, which was fabulous. And then they found that people didn't know how to prepare food. So that was really tough.
Well, and honestly, I don't know a lot of teenagers that are going on into their turning 18 that know how to cook other than like peanut butter and jelly, because we are so used to going to the store, filling up our cart, and then it's already made.
Yeah.
Pop it in a microwave, and they don't know how to cook.
You're very, very right.
I mean,
and so
scary.
If you grow up that way, or if you grow up that way and your mom didn't cook, or mom and dad didn't prepare things, or you grew up in an environment where it's all processed foods and fast foods, how would you know?
How would you know?
So it makes it really hard as an adult. And
Right.
those are the changes that are hard as you get older too, to get people. It's like, gosh, I've never done that. How would I start doing it now?
So there's been an uptick, it seems. Everybody's allergic to gluten. What is the thing with that? Or when I was growing up, nobody was allergic to anything. Now we have special tables for peanuts and things like that. How did that happen?
It's funny. There's a lot of theories, and no one really knows 100%. But like the gluten, for example, I thought the same thing. Oh my gosh, why are all my patients gluten intolerant? Well, the gluten today isn't what it was when we were kids. The wheat itself has been engineered. Everything is different. And so the gluten content of wheat now compared to when we were kids is far different. And that's what they think has caused a lot of the insensitivities to gluten. And dairy is hard to say too. I mean, our food is just engineered. It's all engineered differently and much less natural, if you will, from when we were kids. So that's why a lot of people have developed intolerances.
What is your opinion on unpasteurized milk?
We always say don't do that, right?
They do.
Need that. Yeah. You kill stuff that we need to have killed. But I have patients that do that, or goat's milk, and they're all still alive. So I don't know. But it's something that is a personal choice, and I would never tell anyone it would be unhealthy to do it. But, you certainly
should be
worry
careful.
about, yes.
Right. Because some of the properties in milk are withdrawn when you pasteurize it.
Yeah, absolutely. The milk.
So it's
It's
kind
different.
of a catch-22 there.
Yeah. And I've had patients that, grew up on dairy farms that drink milk right out of the cow. And they will tell you now if they went to taste it, it would be unpalatable to them. They just are like...
It's like a cream.
Yeah, just far different than what we're used to.
Your health journey is as unique as you are. The Peak Great Falls has everything you need for your fitness journey. They are your partner in wellness, with a top-notch facility and expert staff and a very welcoming vibe. Locally owned, community-driven. Join them today. Everybody needs a good insurance plan. Whether it's for home or auto insurance, check out Heinbaugh Agency. Eric Heinbaugh is a local agent focused only on customer service, not sales. The Double Barrel Cafe is all about you, the amazing people of Cascade County. With every purchase you make, they give back to our community. Every bite and sip fuels their mission. Let's make a positive change, one cup and one bite at a time, because the Double Barrel is not just a cafe, they're building a better community. If you haven't noticed lately, Cascade County is booming, and the choice for all your construction needs is Builders First Source. They even have an automated home builders solution for all of your construction needs. Go to 826 Northwest Bypass in Great Falls and check them out today. Are you looking to replace those floors in your home? Or maybe you're doing new construction? The place I trust is Contract Flooring Carpet One. This is a locally owned and operated business here in Great Falls, and they are committed to serving you and giving you the very best prices and the very best product and service. Go see Contract Flooring Carpet One today. If you love a farm-to-table experience as much as I do, then you have to go to the Roadhouse Diner. The local McCafferty Ranch beef served on every burger. Try my personal favorite, death by bacon today. When deciding who I would trust for the technology component of this podcast, the choice was simple: Information Systems of Montana. Whether purchasing products for business or when I had them build me a new MacBook to catch child predators, they delivered, creating a solution for my exact needs. Contact Information Systems of Montana today. If you're passionate about firearms and the Second Amendment like I am, one of the best places in all of Montana to go is Mitchell Supply. Jim and Tammy Mitchell have been running this gun store for decades. They're major supporters of the Second Amendment, and they're major supporters of our community. And obviously, they're supporters of this podcast. For all your firearms needs, go check out Mitchell Supply today.
So is there, and we kind of, I almost know your answer to this, but I'm going to ask it anyways. Is there a way to prepare your body for aging?
I love
And if
that. I loved
so-
that question when you sent it to me. No, I don't know. I don't know. You got to gear up. We got to mentally prepare. No, the big thing is to create habits when you're young. And so I try to tell that to my pediatric patients, their parents, like, get them in the good habits now so that you're as healthy as you can be when you start aging, because with age comes disease. And Dr. Key, that I used to work with, the high-risk OB doctor, he used to say that all the time. And I was like, okay, Dr. Key. And now as I age, you get all the things. Like, it just happens. You are, as you age, you have higher risk for disease. It just is what it is. So you want to give yourself the best chance to avoid some of those. And the only things we can control are what we put in our body. So no smoking, limit alcohol, healthy doses of everything in moderation, and good healthy foods and exercise. And then it's like, the rest is out of your control.
True.
So
Right.
you do what you can and hope you have good genes, because a lot is genetic.
So about that genetic section, but even if you're born with genetics, exercise and good eating and self-care can minimize your chances of getting that disease that maybe your
Absolutely.
parents or your grandparents had.
Yes.
And you could change that for your kids.
Yep, absolutely. So just because your mom or dad had type 2 diabetes does not mean it means you have a genetic predisposition to insulin resistance. But you certainly could stave that off with diet and exercise. So yeah, I don't like people to think, everybody in my family dies at 70.
That's kind of the response that I get usually to, there's no point in exercising. Heart disease runs in my family.
Yeah.
And my father, for example, had a heart attack and completely changed his diet.
Really?
And he's 74 years old now, and he runs 3 miles a day.
Oh, I love it.
And he is
Which is too bad that he had a heart attack, and that's what got him to...
That's what got him there, but yeah.
And probably then for you guys, you and your siblings, you're like, oh gosh, like I don't want to have a heart attack. And so some of those things can be eye-openers for other family members, but it doesn't mean that that's your fate. So
Right.
that's a good point.
So you can create your own reality, if you will, your health
Exactly.
reality. You can take steps to prevent that. That is not something that's going to happen to you for sure.
Yep, you're exactly
Okay.
right.
Talk to me about antibiotics, because everybody wants to get on antibiotics as soon
Yeah.
as they get a cold.
Oh.
And how long? And
It's
I
my
mean,
soapbox, Christy.
when I was had little tiny children, you get really worried when you're, especially when your babies are sick
Sure.
and they can't breathe, because you know that babies can get really sick. But when you're thinking about from the time you're born to the time you die and the amount of times that you could be put on antibiotics, are they good? Are they bad? What do they do to your gut? What is your opinion on antibiotics?
Antibiotics are very useful in a bacteria, not in a virus. Most cases of the common cold, all these respiratory illnesses that we're seeing, vomiting, diarrhea, all those are viruses. And they're really common, especially right now in the cold and flu season. And antibiotics do no good against a virus. And so people do think, I need an antibiotic. Oh gosh, well, I've been sick for too long. I got to get one and then I'll get better. Well, they may go in and get one. Hopefully not. If you saw somebody that values that we're trying to limit antibiotic use for what it's appropriate to and reduce our antibiotic resistance, but they'll get it and then they'll feel better. So then the next time they think, well, I'm getting on that antibiotic sooner because I felt better. Well, you got better because you went in on day 7, and viruses last for 7 to 10 days.
And by the time you're done with your antibiotic, it would have passed anyways.
Yes.
So what do antibiotics do for your body?
So they kill the bacteria that's causing your infection. So for example, if you had a urinary tract infection, I would give you an antibiotic. Kills that bacteria, great. So then your urinary tract is back to healthy, you're good to go. Or a sinusitis that has been going on for 2 weeks, we think could be bacterial. It finally clears that up, you feel better, great. But antibiotics aren't without some problems. Many people that take them say, oh my gosh, my stomach's been upset, or I've had diarrhea, because they kill good bacteria in your guts, the microbiome that we were talking about earlier. They take away that good bacteria. So people will have a little unrest in their GI tract for a while. Maybe they don't feel good or they have diarrhea, and it takes a little while for your body to restore that. So they're not without some harm, usually not big harm, but people just don't feel really good. So we want to make sure we're using them when it's appropriate. So if you need them, we use them. If you have a virus, we treat symptoms, run a humidifier for your babies and use Tylenol or ibuprofen for discomfort, and the rest just kind of has to run its course.
Okay. I want to go back to the microbiome, but first I want to ask you, how do you know when a virus turns into an infection?
So with a thing it doesn't turn into a bacteria.
Bacteria.
But you're, like with a sinusitis, for example, I see a lot of patients with sinusitis, sinus congestion, pain, where they bend over and their face feels like it's going to explode. We always thought they were viral. So they're likely viral. But sometimes antibiotics would help if people kept getting them. So they finally did a study on it, and I don't know who would volunteer for this, because they aspirated fluid out of the sinuses to check.
Wow.
And 80% are viral. So good, now we've got data. Okay, 80% are viral. So the CDC tells us to treat it that it may be bacterial because of this study if it goes on longer than 2 weeks, or someone gets better and then gets worse. And so that's kind of the guideline for using an antibiotic. But if you get someone that had gone in and gotten an antibiotic every time, it's very hard to tuck them out of it once they've had that and they've felt better. So I give that spiel probably twice a week at this point in time. And most of my patients are very receptive to that. Oh, okay, great. Like, thank you for explaining that to me. Mm-hmm. Some of them aren't very happy. It's like, that's what they're used to. So they'll wait. And I'll say, if you're not better, you don't have to come back in. Like, I think people think that we try to take all their money by making them come back in. I'm like, you don't have to come back in, but just call me. And if you're still sick.
Because it could be something worse at that time. But right now, an antibiotic would not be good for your health.
And same with ear infections with babies. We used to treat them quite a bit with antibiotics when I was in school. Then it started to come out right towards the end of my training that we don't need to use antibiotics. So now more and more we are told we don't need them. And so I'll tell people, if you treat an ear infection with antibiotics, it goes away in 7 days. If you don't, it goes away in 7 days. Uh-huh. So we kind of leave it. So I'll write him a prescription and I'll say, hey, if he's not better next week and he's still fussy, pulling at the ears, has a fever, you can go ahead and treat it. It's called watchful waiting. The American Academy of Pediatrics came out and did this. And so a lot of my students will say, oh, well, everybody fills those antibiotics. I said, no, they don't. So when they'll come back for a well visit, I'll say, did you ever fill those antibiotics? He was better. Mm-hmm. And they appreciate that because, I've told them, if we don't need an antibiotic, let's not use it. Most, especially parents, will say, oh, yeah, I don't want to do that. But some people, they are misinformed a little bit, mm-hmm. or growing up, they went in for every cold they had and got an antibiotic. And that's a hard education piece.
When Jesse and I were new parents, we brought in our son anytime, all the time. I'm sure our pediatrician was like, oh, these guys again. And gosh, ear infections are so tough.
They are tough.
For babies. A question about babies, but also adults. What fever is so high that you need to go right to the doctor?
It's funny. I get that question a lot. So I'll get a text from a patient. Oh my gosh, his fever's 103.
Wait, did you just say that I could text you?
Yes.
What hours?
We're like, oh.
Shouldn't have said that.
Christie again. So they ask that because fever worries parents the most.
Very.
Because they look like crap, right? They're
Well,
laying there.
and you have brain damage. They say,
yeah.
if it
You're
gets too high, you
sure,
could,
or they're
your
going to have a
baby's gonna-
seizure.
Yes.
And so that you're exactly right. So parents will get upset. But for me, fever, I would say, oh, good. Their fever, that's good. Their body's heating up their blood to kill the virus. Fever is a good thing. It's causing inflammation. It's getting
Interesting.
the virus to die. But it makes them feel like crap. So they just are listless. They don't feel good. So I always tell people, what do you feel like when you have a fever? You don't want to touch anything. You just don't look good. So you treat to comfort. So I said, we're not treating the number. We're not treating the fever. But if they are uncomfortable, you treat it. And as long as it goes down a degree or so with Tylenol or Motrin, it's likely viral. You're doing great. No worries. And then it will bounce back up. So then I get another call. It's bounce back up. Yes, it's doing its thing. If it's low grade, if it's like 100.4 or less, let it be. I would say let it ride. Let it kill the virus. But if they're uncomfortable and it gets up there, let's do it. So I don't have a number per se. The higher it is, generally the more uncomfortable the kids are. But it's not dangerous unless it doesn't come down. And
Over what time period?
usually I tell people if you give 2 doses of Tylenol or Motrin, it's not coming down. I have other tricks. I'll tell them to put them in the bath and leave their hair wet, and that'll help kind of bring it down. But if it doesn't come down with appropriate dose of Tylenol or Motrin, because people always underdose because they forget the kid has grown, so they're giving the dose they gave, 6 months ago. Or they don't want to give them too much, so that we underdose them. So I first check the dose of Tylenol, have them give them the appropriate dose, and then do the bath. And I can't think of a time where it hasn't come down
Okay.
in 17 years.
All right.
It just always does.
So if I have a sick child, I'm basically treating their behavior, not
Yes.
necessarily. I mean, if they have a fever and they're okay and they're eating and they're watching TV, leave them be.
Yes, it's very hard for people because you don't want anything bad to happen. You get worried as a mom that you're doing the wrong thing. So that's what I'm there for, reassurance. So they call me and say, oh no, if he's doing good, just let it be, let it ride. But yeah, I think people think we're treating the fever. We're not treating the fever. The fever's a good thing. We're treating their discomfort.
Yeah, interesting. And is that the case for adults as well?
Really, yeah. I always tell you, people say, oh my gosh, I had a fever. Oh, well, what was it? And I always kind of chuckle in the office because it was 99.5. Oh, well, that's not really a fever. The definition is over 100.4. So I have patients that themselves, even as an adult, they'll kind of overtreat it. But yeah, same in adults. I always tell people, if you feel okay, just let it ride.
So when you were talking about inflammation earlier and how it helps protect your body and fevers, that reminds me of teething.
Mm-hmm.
Babies get fevers when they're teething, but that's inflammation
Yes.
fighting.
Because they're getting inflammation in the gums.
And they're getting kind of a cut there.
Yep.
And your body's trying to heal that.
Yep. You're exactly right.
Interesting. Okay. So kind of, is it your opinion that less medicine, the better?
Yes.
Okay.
I think less medicine, the better. Now, some of my patients will tell you, oh my gosh, she's going to put me on another medication. And I always say, I don't like to, but sometimes we need medications.
Sure.
And so my patients that are on multiple medications that have diabetes and hypertension, we use them. And in kids, we use them if they need to. But absolutely, if we can go with less medications, I always say, I don't like medications either. And they look at me like, well, then why do you have me on 5? Well, because we need them.
If you're saying they need to be on medications, they need to be on medications.
Yeah, I try
Okay.
not to willy-nilly. And I think most providers would feel the same. Like, I would love it if I, had patients on no medications in their 70s. It's
Yeah.
rare. But absolutely.
Is there any foods that have medicine in them? Medicinal properties?
Okay, so that is a good question. Not really. Like, there are foods that we think can have some benefit. Garlic, allegedly, can help, with heart disease. But, oh my gosh, I always tell people, if I thought that a food could help, by all means, we would be using it. Cinnamon has gotten out there as maybe helping with metabolism. Okay. It can't hurt, and if you're, it's not harmful. But no food would replace a medicine. If you actually needed something, and I have patients that will tell me that, and I go, okay, and great. And if it
Works for you.
works for you, then great. But not really true medicinal properties.
So I read an article that said that we should be having between 15 and 30 plants a day. And not necessarily plants, but organic food. So like an almond, an egg,
Yeah,
cinnamon, between 15 and 30 a day.
that's a lot. You're committed.
But if you think about like a salad, that has
That's true. You got a lot in there.
like 15 right there.
I think that's great. I think that does sound like a lot. But absolutely, so all of these things, those little nuances that
Not
you
the
read.
entire plant, but
Okay,
just
just a
like,
piece of it.
even like a seasoning.
Absolutely. And basically what you're saying is to have more healthy whole foods.
Sure.
And so I think you can't go wrong with that. And I don't know. It's not wrong to say that, but I don't know who came up with 15.
15 to 30.
15 to 30. You got to be
So
committed.
you got coffee in the morning.
All right,
that
we'll
counts,
take it. And truly, if you thought about that, like basically you should be eating whole good foods all day.
You should be.
You should
Right?
be.
But
So if
to
you
start
said-
at like 15,
Yeah, I think it's reasonable. I'd probably put little tiny pieces of arugula.
you could.
There's 15.
Just as long as it's 15. So this is kind of a switch a little bit before we talk about the microdome. Tell me that name
The
again.
microbiome.
There you go. You might have to do that a little bit. How does the medical field, and you might not be able to speak for everybody, but we do have a lot of addiction out there, opiates, maybe some benzodiazepines. How do you treat somebody who really is in genuine pain, but they have an addiction? And
Ooh, that's tough.
I mean, but they are hurting.
Yeah.
But it's like this vicious cycle, and how do you break that? Because if they don't get it with you, they're going to go on the street, possibly get, these days, even something with fentanyl in it.
Yeah. It's very real, and it's a valid question. It's not an easy question to answer because, it used to be, if you go into the ER, you got a cut, you're a broken bone, you're going to get opioids. You should. I mean, that's the only pain med we have, and so, but then we kind of overdid it, right? In the 90s, it was like, oh God, you gave people 90, MS cons. Oh dear, like, oh gosh. And then we had the opioid crisis. So we got to get rid of them all. We can't have them. Well, now we have people that don't get treated properly for their pain.
Right.
So it's a very hard thing. And I just had a patient that had been to the emergency room, ended up with she had a broken hip, and came away with anti-inflammatories and not opioids. She sees me for follow-up, and she's ticked.
Excruciating pain,
Yes,
probably.
and she's hurting. I don't use the opioids anymore. I'll tell you, I used to prescribe them here or there. We had a patient with a C-section that then went home early and then needed a few more. Okay. I don't really have a place for them in my practice, doing true family practice. I just don't. And if someone requires those, or I've written for them, if somebody has a kidney stone, something like that, very short term. But if they're requiring those, we send them to pain management. Whether this be right, wrong, or indifferent, that's what we've kind of done to try to manage opioid abuse. I don't know. It's very hard. So this lady, I gave her some opioids, and then I get a call from the pharmacy, which is great, because he's like, well, she just got some of these from I said, yes, I know. She's got post-op hip pain. This is what we're going to do. But then no one really wants to treat it. Like, so the surgeon, okay, you got to see your primary. Well, I'm not treating her broken hip, but I got to treat, this lady's looking at me in my office in pain.
Right.
That's tough. And whether there's an addiction history there or not, we have to treat people's pain adequately. But we sure worry about, because all of my patients that I took care of in pregnancy with opioid addiction had the same story. I had a shoulder surgery, and then I wasn't sleeping good. I had stopped taking them, but I wasn't sleeping good one night, so I took one. And that unlocks the brain. We've got now an opioid addiction. So now we see a lady in pregnancy 2 years later that's addicted to opioids. She's getting them on the street. What do you do?
What do you do?
So when I worked with Dr. Key, we wrote for them. there are some people that would disagree with that.
You could die, though,
Yes, we cannot have a woman
Without-
withdrawing from opioids that's
in
pregnant.
withdrawal.
And so that was his way of handling it. I don't know if my colleagues now would do that. I don't take care of generally. I see some OB patients, but I don't have my own patient load with them on it. So I don't think we do that anymore. I think we send them to pain management, or then they're put on Subutex, an alternative.
Which is just something else you have to get
Yes.
off of later.
It's horrible. And the opioid crisis is very hard. And it's hard to know what's right. I tell you, like low back pain, that's what I would see more in primary care. Low back pain. Oh gosh, we used to give people Vicodin or Soma and tell them, go lay down for a week and then go back up. Well, no one can do that.
Well, how can I get on that?
Yeah.
I want to.
So I don't do it anymore, Christy. You're out of luck. So we quit doing that. And then I think back and I think, oh, girl, this is just what you did.
Yeah.
And now you don't. Well, now they've come out and said opioids are not the proper treatment for low back pain. It's not. We knew it probably never was. But if you could lay down and do nothing for a week and relax all your muscles, it would heal. So now, so there's like this double-edged sword. So I don't use them anymore. I say, you don't need them. If you do, you're in the wrong place. Because I am primary care. I don't treat acute pain like that. They should be in the emergency room.
Well, and I think that people get a lot of affirmation from their provider that, you know, I'll come and check with you and you'll say, no, this is not a problem. Don't worry about it. Just keep going. Or we have to do something about that, which
Yeah.
is why I'm so happy you're here today, because I think that not a lot of people have that option.
Yeah, so people
with
don't
no
have a
healthcare.
provider. You're right. Or they go to the walk-in. It's someone that they've never
walk-in.
met. And so ideally, in a perfect world, everyone would have a primary care provider, someone that knows you. So I'm like, you know, it's far different for me to treat my patients I know than a first-time patient coming in, because I don't know them. I don't know their full medical history. So I wish everyone could have a primary care person, and that's just not the case. One, we have a primary care shortage, so not everyone could see one if they wanted to.
That's sad.
It is sad. And we're seeing that all over the country. It's not just in Montana. But there's less physicians. So then we need to get more nurse practitioners and PAs. Well, there's not enough of us to go around, and there's just not a lot of people doing primary care. And there's less people going into medicine. So it's like
What's your
a vicious
opinion on
cycle.
that? Why is that?
You know, it's hard to say. There's a lot of things why. There's not very many residency programs for physicians. So they may go to medical school and then there's not enough residency programs for them all. So they limit the number that get into medical school. But we need them. But we don't have enough programs. Like it's very hard.
And medical care is essential.
Yes.
I mean, if anything needs to
And
be
it's getting
staffed,
more so. We're getting older, you know, the baby boomers are getting
people are
old.
living longer.
Huge, absolutely. So it's a real problem, and it's a problem everywhere. I don't know what the answer is. I have some
You wish you
theories.
did.
Yeah, exactly.
You wish you had the answer.
So and then people don't have health insurance, or they don't have adequate health insurance, or they don't use it. And so if everybody could get a primary care provider, I think we'd see a lot less issues with things like that. But
is there any collaboration when you have a medical care provider with, say, the ER staff or a walk-in clinic?
That's
Because
tough.
I think like you re-explain to the gal at the front desk, then you go back and you wait in the room, and then someone else will come in, and then finally the doctor will come in. You told your story like 3 or 4 times, and I always wonder, what are they writing down? And
Yeah.
like,
well, it's funny you
Why
say
do you
that,
say
because
that? And then-
why do we do that 10 times? And we do. I hope that I would listen to most of the time I don't see my nurse before I go in, because and same as in the walk-in, they're just going room to room. So then it's always better to hear from the patient. So I go in and say, what brings you in? People are like, oh my God, I told the 3 people. But if I say, it says so maybe now we have a new person rooming patients, and maybe it's our CNA that just started this week. So I'm like, oh, you're here for this? And they're like, no. It gets kind of misconstrued. It's like the telephone game. Whatever it says on my paper is not always what the patient's here for. So, and it's kind of how you're taught too, to go in and say, what brings you in? But it drives people crazy.
well, my question really is, can I not tell the original people why?
You can, and some people won't.
I just don't. I just want to explain it to her.
Yeah.
I just want to tell.
And so some people will say, I just have a problem. I want to see Gretchen.
I know.
And my scheduler's like, well, what kind of appointment? And truly, they don't care. They're not delving into your private medical history, but they have to know what kind of time slot to give you. So then some of them won't tell her, which is fine. So they'll talk to the nurse. And some maybe won't tell her. So I'm like, just put them in for a 15-minute visit. We'll hope for the best. So they're trying to get at, and I wish they would say that. Like, how long do you think you need? Or is this a short? But that's hard. A patient might be like, I don't know.
3 hours.
Yeah.
Or I'll take
Block
her
out
cell
the
number.
afternoon.
I've heard she takes texts at 11 at night.
Exactly. So patients will say that, though. That's a common thing. So we always think maybe we should word it differently. So maybe I'll tell my scheduler that. Or do you think
sickness, mental health.
Yes. And truly, that would be all we need to know for the type of visit. Or just say, I'm going to put you in for a short visit. It's a 15-minute slot. Do you think that will work? Or or just tell people, what do you need to see her for? I'm just trying to figure out what time slot to give you. Because I think that would come across better than what's wrong with you, especially working in women's health. There are a lot of sensitive issues that people don't say.
Sensitive issues that I don't want to tell 2 and 3 people.
Yeah.
And I really don't want to tell the lady walking up to the front desk.
Exactly, where everyone's
where
standing
everyone's
behind
listening and is your address still? It's like,
I know.
yes.
It is kind of a funny way. Yeah, please don't announce where I live. I know. There's a lot of things in the medical community that we could probably do better at.
I don't think I let you answer the question about the collaboration of the
so
ER.
I get their visits notes. So usually if you're seen at the walk-in or the ER, I get a courtesy copy. So that'll come across my desk and I'll see the visit.
Cool.
If sometimes that doesn't always happen, or they maybe didn't say I was their primary provider, if they're coming in, my nurse gets in the computer. We can get things from all over town. So she'll print it out and it's in there. So that is good, and which is helpful because some patients don't know what they did, or they gave me a white pill. Oh, Lord.
Oh, dear.
But if I've got the records, then I know exactly what they did. And so we try to do that, and that's gotten better over the years as things have become electronic compared to when I first started. We almost always have all that, or I can at least get it, or I can look at their x-ray from the clinic instead of, coming in with no information or reinventing the wheel. I always say, let's pull the lab so we don't,
Have to do it again.
do the same thing twice. Yeah.
Okay. So can you talk a little bit about the
Microbiome.
Let's spell it.
Oh, geez, like
I have it written
spelling
down.
test.
Well, just in case anyone wants to look it up, because I thought it was very fascinating. But in talking with you prior, we'll kind of come up a little bit about here the gut microbiome, which if anyone wants to look it up, and we're going to put little tags on our video, but where is that thing?
The
So many questions.
Microbiome.
That's
Did I get it?
Yep,
Nailed
you
it.
did. So what is a gut microbiome?
So microbiome is really, microbiome is everywhere, not just the gut. It's little tiny microorganisms that are all over our body. So some bacteria, some fungus, not to gross anyone out, just very little. I mean, you guys have all seen those in science class, all the little tiny bugs floating around, and they are everywhere. And microbiome just means the group of those organisms that are somewhere. So gut microbiome has become a big thing because people are talking about, oh, you don't have good gut flora or good microbiome in your gut, and that can lead to all these problems. Inflammation, it can lead to heart disease, it can lead to your brain not functioning properly.
And this is all in your stomach that you're talking about.
All in your stomach. But we don't really know all those exact, like, what does it affect? We know it affects your gut because if you've got problems where you have diarrhea or you've got belly pain, it can a lot of times be a problem in those. But now it's kind of a big industry to talk about microbiome in the gut. And so you read that, it's like, oh my gosh, I better buy this supplement. And so there's a lot of misinformation about it, but it's coming more and more to light that our gut health impacts a lot of things. Now, if you think about it, we really knew that over time. We talked about if you could eat better, and most of your problems would be fixed. I guarantee you would feel better if you eat better.
That just sounds comforting. It's an easy fix.
Yes,
in a way. It's
in
not
a way.
easy, but
Yeah.
it is. We have the option.
Yeah, we can do that, and we don't need to have 50 supplements, but it's kind of a big industry right now. So people ask me, which probiotic should I use? I don't know. I'll tell people.
Or even do you need to?
Or do you need to? Most normal, healthy people don't need an extra supplement or an extra probiotic. Most of us have pretty good gut health. Now, in times of illness, if you were to get like salmonella or another intestinal problem, or just had a bout of diarrhea from a gastroenteritis, a stomach bug, I would tell you, hey, you should eat some probiotics. Or if I were to give you antibiotics that kill your good gut flora, like we talked about earlier, I tell people, eat it with some live culture yogurt if you like it. Some people like yogurt, some don't, but that has probiotic in it. You know, a good Greek yogurt, you look on it, has lactobacillus. That's a part of a probiotic. So that is good at help repairing your gut to get back to its normal state, which your gut biome is different than my gut biome. Everyone's is different. You're kind of born with some of that. And so, and then the rest comes from your diet and how healthy you eat. And so if it needs repair, so to speak, after an illness, I think a probiotic can be helpful. And I have recommended them. But do I know which one? No, that's not regulated by the FDA. I always say, ask the pharmacist. Sorry to my pharmacist friends. I tell everyone to ask you everything. But they know a little more about what's current. And that, again, is not regulated by the FDA. So we don't really know what's in it.
Interesting.
So that, and then they'll say, 10,000 of
10,000,
lactobacillus.
that's gotta be
That
great.
seems good. No, this one's 100,000. I'm buying that one.
Uh-huh.
Okay. It's a big industry.
Right.
And it's the kind of the thing right now. And I would just think, if we could just go back to eating healthy, we could save a lot of money on the probiotic and you'd have more money to buy the whole foods.
So outside of an illness and outside of a supplement, how does your gut affect your overall mood? And is there a connection between your
I
gut
don't know
and
if
your
there's
brain?
there's a connection in that you feel better. And I think, but I don't know the direct correlation. There is a lot in the internet and buzzwords about that, but I don't know how directly it would affect it. I just think if you eat better, you have good gut health, you feel better, which affects your mood and all of the above.
So I hear a little bit about hormones. Is there something that you can do to basically break down hormones for me?
Okay, so
Because-
hormones are tough. Here's the simplistic
Okay.
thing. Your hormones are normal. Everyone's hormones are normal. So if you're a menstruating female, they're normal. They're going to be abnormal when you go to menopause, but they're normal for menopause. That is kind of the Western medicine way of hormones. Like there is no, so people ask me if I can test their hormones. I can, but I'll tell you they're normal. You're a menstruating female. But there's a different school of thought from more of the Eastern medicine side, naturopaths and some pharmacies will do this, where they'll test your hormones through saliva, and then they'll offer some supplements. I don't know enough about it to speak to it because it's just not in my training. It's just not the Western form of medicine with hormones. So if I test someone, I don't generally test them. I'll test them if it's like, oh gosh, do we need to put in another IUD? Like, are you still fertile? Are we?
Sure.
So then it's like, okay, we'll test your hormones and see. Oh no, your estradiol is really low and your follicle stimulating hormone's really high. Going, hey, we need more estrogen. You're menopausal. That's the laboratory definition.
So you can actually tell through lab work when someone is menopausal.
No, I don't. Do I need to? No. I go, have you had a period for a year? Nope. Oh, good, you're menopausal. I always tell people, I can draw a lab if you want. Or people will say, I want to know where I'm at. We always kind of giggle about that too. Like it's a scale. Oh, you're a 7 on the menopause scale. Like there's no, and it varies so much from day to day in the menstrual cycle that it doesn't tell me anything.
And how much are hormones involved in emotion?
Oh, well, huge. We know that. So we've all had teenagers, or maybe not all of us have had, but teenage girls that are menstruating, just starting to hormones throughout the menstrual cycle, and you see a lot of mood swings. Normal. So we know pregnant women.
It's really annoying, though.
It's very annoying and you want to get rid of it.
You do. And is there an easy way?
I know.
Because
No. Isn't that horrible?
As in the human being, when you wake up and you're crabby for no reason,
I know,
why?
it's very annoying.
Why?
And so what do you do for that?
What do you do for that?
I don't know. So I tell people, and there certainly are conditions that are associated with like premenstrual dysphoric disorder, very serious mental illness that can come with PMS. There's some PMS type symptoms, and we certainly blame those on hormones. But there's nothing really to do for it because that's your natural function.
Where
That's
are they
how
created in your body?
your ovaries. We could
What
just
about
take them out.
with males?
So males are different. So there's more in the pituitary gland and their hypothalamus and some scrotum and sex organs. But women, it's the ovaries that control the hormones. So if you, and that's what happens in menopause, those ovaries just start to shut down. So would they shrivel up? We used to say that, and I'm like, I do not say that now that I am, of age in the wheelhouse. It's like they just start to, shrivel up and die. It's like, oh, that sounds awful. But so that's why we leave the ovaries in when they're doing a hysterectomy generally, unless they need to come out. Because if you put someone in early menopause, we worry about osteoporosis and heart disease, things like that. So they'll go through menopause just like anyone else. We just don't have the periods to guide us. And those are the people too that will say, I'm menopausal. I'm like, I don't know, are you having hot flashes, night sweats? No. Yeah, then probably not. But we don't have the periods to guide us. So there's a lot out there about hormones, and you'll see that. Like, it's a hormone problem. I have patients on my schedule all the time. Hormones, check hormones. How old is she?
Yeah.
28? No, I'm good.
Right.
It won't help. And that's
Yeah.
frustrating for people because it is frustrating.
So for obvious reasons, women kind of have an up and down with the hormones. Men, they produce hormones. Do they go up and down? And
No, they don't cycle through. But again, we talked about like as
The
they age.
testosterone.
Yeah, but they don't per
They
se.
don't.
They don't even, those lucky
I mean,
sons of guns. I know we have all the things. That's what we say. Like women, we have periods and we do the pregnancy and then we got menopause. It's really unfair.
it's
It's
just so
just how it is.
bizarre that they would not have
Yeah.
the spikes in hormones.
And that's from the menstrual cycle. I mean, that's what we do. The body preparing the uterus to be pregnant. And that's why we have, so it's just all, it's all related to, we hate the uterus and the ovaries. That's what I tell people. Your uterus is against you. I don't know, and we laugh about it. But there's just not a lot
it's interesting.
that we can do for mood particularly. Like, and when we treat with hormones, giving people estrogen and progesterone in menopause, it's to treat their hot flashes and night sweats. Will it help mood? I don't know. I mean, okay.
Yeah.
But we don't really have much.
I
for
think
that.
women in some regards have to be stronger because
Agreed.
because they have a lot more stimulus and a lot more irregularity because of their body. Mm-hmm. And they still have to go through the day.
Yeah.
Just like a man
There's
does.
a lot going on, and
There's a lot going on.
There's certainly and a debate always about men and women, and who has it tougher or this or that.
Mm-hmm.
But there's a lot of different things to deal with when you're talking about the female body in that way, especially. And emotions are tough because so much goes into that.
So much goes into your
Yeah.
so much goes into your emotions
Yeah.
and how you decide to face the day.
Yep.
And when your body's working against you, you're
Yep.
like, really, not today.
It's tough. It is tough.
But self-care, good exercise,
Huge.
good diet, exercise can really go a long way.
Yep.
So I feel, did you know that we've been talking for an hour and a half?
No, I didn't. Holy cow.
I feel like I could have 1,000 more questions
We
for you.
could be
Actually,
here
we only
forever.
got really through a quarter of this page.
Oh my gosh. Yeah.
I've really learned so much talking to you, and I just have even more questions. Where could people find you if they wanted to see you
They
as a
can see
medical
me
provider?
at OBGYN Associates. We're over in the old Great Falls Clinic building, 1400 29th Street South. And they can call and make an appointment. I'm happy to see them all.
And Gretchen Fowell I can tell you that I've told you things that I probably may not have even told my husband.
Ooh, I like it.
And then just a really funny story. You don't just treat women, because my husband went to you.
Yes.
And you being
He's appreciating this right now, I'm sure.
Oh, well, he's going to appreciate my next comment. Do you know why he quit coming to see you?
Why? He can't hang at the OBGYN Associates?
Well, when we were talking about the different things that happen and the different tests that happens to men in around 45.
Oh, yeah, the wimps. We always laugh about that. Like they don't
want
I feel
a woman
bad
to do
testing my
that.
prostate. And it's funny because we used to say that in school. Like, oh, I feel bad doing this. And then I thought, what do we feel bad about? We got women in the stirrups all day long.
Have to go through. And by the way, why are the speculums square and hard and metal? Did a man invent that?
Invented them.
We need a
Well, I always
soft,
say-
warmed.
Oh, and ours are warmed. We have a warming drawer, so they're warm. But I always say if a man had to do a pap smear, they would be far different. They would invent a scanner. Like, boop.
Oh, it would be done immediately,
Yeah.
wouldn't
But no, here we are.
it? It's such a pleasure to have you here. I want to toast you
Thank
one
you,
more time
Christie.
to all of your knowledge and
Thanks
just the
for
person
having me.
you are. Thank you.
Thanks.
Your health journey is as unique as you are. The Peak Great Falls has everything you need for your fitness journey. They are your partner in wellness, with a top-notch facility and expert staff and a very welcoming vibe. Locally owned, community-driven. Join them today. Everybody needs a good insurance plan. Whether it's for home or auto insurance, check out Heinbaugh Agency. Eric Heinbaugh is a local agent focused only on customer service, not sales. The Double Barrel Cafe is all about you, the amazing people of Cascade County. With every purchase you make, they give back to our community. Every bite and sip fuels their mission. Let's make a positive change, one cup and one bite at a time, because the Double Barrel is not just a cafe, they're building a better community. If you haven't noticed lately, Cascade County is booming, and the choice for all your construction needs is Builders First Source. They even have an automated home builders solution for all of your construction needs. Go to 826 Northwest Bypass in Great Falls and check them out today. Are you looking to replace those floors in your home? Or maybe you're doing new construction? The place I trust is Contract Flooring Carpet One. This is a locally owned and operated business here in Great Falls, and they are committed to serving you and giving you the very best prices and the very best product and service. Go see Contract Flooring Carpet One today. If you love a farm-to-table experience as much as I do, then you have to go to the Roadhouse Diner. The local McCafferty Ranch beef served on every burger. Try my personal favorite, Death by Bacon, today. When deciding who I would trust for the technology component of this podcast, the choice was simple: Information Systems of Montana. Whether purchasing products for business or when I had them build me a new MacBook to catch child predators, they delivered, creating a solution for my exact needs. Contact Information Systems of Montana today. If you're passionate about firearms and the Second Amendment like I am, one of the best places in all of Montana to go is Mitchell Supply. Jim and Tammy Mitchell have been running this gun store for decades. They're major supporters of the Second Amendment, and they're major supporters of our community. And obviously, they're supporters of this podcast. For all your firearms needs, go check out Mitchell Supply today. Hey everybody, Christie Slaughter with the Pursuit Podcast. And we really appreciate the amazing support already that this channel has received. Our social media is blowing up. Everywhere we look, people are liking and clicking and commenting. But what we really need you to do is subscribe to our Facebook page and follow us on Spotify. That's what drives this channel. That's what's going to keep this channel going forever. Tim and Ben are behind the scenes doing tireless editing, working on this to make this come out the way it does, this high quality product that it is. So please go in there, click subscribe, click follow, and make sure that this channel sticks around for a long time, because we truly believe it's doing a lot of great things for our community. But there's many, many other people out there who we need to support. So follow and subscribe today. Thank you.